First, observe for vomit or objects obstructing the patient's airway thoroughly. Check for any burning nasal hairs or soot around the patient's nose or mouth. Look closely for signs of head or neck trauma in the unconscious patient. Check for an expanding neck hematoma, indicating bleeding beneath the skin. Assess the patient's mental status for any significant alterations. Listen attentively for abnormal airway sounds, including gurgling, snoring, or stridor. Notice noisy breathing, which can point to airway obstruction or difficulties. Ensure to stabilize the cervical spine to prevent further injuries. Open the airway using a jaw thrust maneuver, avoiding head tilt chin lift. Suction away airway secretions and remove any visible foreign objects. Place an oral or nasal airway if necessary, cautiously avoiding facial trauma. Plan for rapid handover if there. Look for increased work of breathing and abnormal chest wall movement. Check for tracheal shift and sucking chest wounds. Observe for cyanosis and signs of chest injury like abrasions or bruising. Inspect for circumferential burns impacting breathing. Listen for absent or decreased breath sounds carefully. Check for dull sounds or hyperresonance with percussion technique. Feel for crepitus, cracking, and popping through palpation. Give oxygen immediately in case of breathing issues. Perform needle decompression, provide oxygen, and fluids for tension pneumothorax. Apply a 3-sided dressing for sucking chest wounds carefully. Assist breathing with bag valve mask ventilation if oxygen is inadequate. Prepare for rapid transfer if chest burns restrict breathing. Plan for escharotomy. Assess circulation with capillary refill greater than 3 seconds. Observe for pale extremities, indicating poor circulation. Check for distended neck veins, suggesting vascular issues. Identify external and internal bleeding areas like chest, abdomen. Examine burns for size and depth, indicating severity. Feel extremities for coldness, signaling compromised circulation. Check for weak pulse or tachycardia. Manage circulation with direct pressure or deep wound packing. Apply tourniquet for amputated limbs or uncontrolled bleeding. Start 4 fluids for ongoing blood loss and poor perfusion. Administer 4 fluids for burn injuries based on size. Splint suspected femur fracture for stability. Bind suspected pelvic fracture to immobilize. Leave penetrating objects in place, stabilize and transfer. Assess for confusion, lethargy, or agitation. Look for seizures or convulsions. Observe for unequal or sluggishly reactive pupils. Check for skull deformities. Look for blood or fluid from ears or nose. Assess Glasgow Coma Scale, GCS. Evaluate movement and sensation in all limbs. Check blood glucose in confused/unconscious patients. If GCS is below 9, plan rapid transfer. Reassess airway in lethargic or unconscious patients frequently. Consider spine or head injury with altered mental status. Administer oxygen. Provide glucose if low or unable to check. Administer benzodiazepine for seizures. Remove all clothing for thorough examination. Check entire body for injuries, including back, groin, underarms. Use log roll maneuver to assess patient's back and spine. Suspect spinal injury? Perform log roll for careful examination. Remove all restrictive clothing and jewelry for comfort. Dispose of wet clothes. Dry patient thoroughly. Cover patient quickly to avoid hypothermia. Maintain respect and protect patient's modesty during procedure.